Hello everyone and welcome to Star Health Insurance YouTube channel. I'm Dr. Manjunath Pandit, intervention cardiologist. In this video, we will talk about why is it important to get your heart valves checked. So let's dive right into it. Structure of the heart is a beautiful creation of God with great detailing and complexity. Even with today's advances in science, we are unable to successfully replicate or produce a total artificial heart till date. It will amaze you if I tell you that this complex structure of heart develops from a state tube filled with water in a mother's womb. Now, when we study about the structure of the heart, there are a few important constituents. There are three layers of heart, namely the epicardium, endocardium, myocardium, and then comes a cardiac muscle. So since it's a muscle, it needs nutrition and oxygen. So there are arteries supplying it and carrying out by veins. There are four valves. On the right side, we have got a tricuspid valve and a pulmonary valve. And on the left side, we have got an aortic valve and a mitral valve. And then there are two great vessels carrying blood out of the heart to lungs and the rest of the body. Valves are located between two chambers to facilitate free unidirectional flow of the blood. These valves have flaps that open and close. These flaps make sure that the blood flows in the right direction through the heart and to the rest of your body. A healthy valve prevents the backward flow of the blood. Since it is unidirectional, the blood has to flow from point A to point B and not from point B to point A. When the heart beats, the flaps open to let the blood through. Between the heartbeats, they close to stop the blood from flowing backwards. So what are the types of heart valve disease that we know of and we should be watchful about? Heart valves can have three basic kinds of problems. Let's discuss the first problem, that is regurgitation or backflow. To say it in a lay term, that is a leakage in the valve. Happens when the flaps of a valve don't close tightly. So as I told you, to let the blood out, the flaps of the valve has to open. And after the action is complete, the valve flaps has to close back to prevent any backward flow. A common cause of regurgitation is prolapse, where the flaps of the valve flop or bulge black. So when there is a bulge of this one of the leaflets, one of the flaps, there creates a gap between the two valves and then there is a leakage of the blood back into the chamber where it began from. Prolapse most often affects the mitral valve, as I said, the left-sided valve. Then comes the next disease, which is stenosis. To simplify it, it is the narrowing of the valve. The valve which should normally open to a certain diameter is not opening so. So stenosis happens when the flaps of the valve become thick or stiff or stuck together. This prevents the heart valve from opening all the way. The normal movement of the valve should be in this way, but what is happening is the valve is not able to move since it is stiff and the diameter that it opens or lets open is very less. As a result, not enough blood can pass through the valve. Aortic valve stenosis is a common type of stenosis. It affects the valve that controls blood flow into the large artery that carries blood out of the heart to the whole of the body. And then comes the third variant, which is atresia. Atresia happens when a heart valve did not form properly since birth and does not have an opening for the blood to pass through. Sometimes a valve can have both regurgitation and stenosis, which means a valve can both have a leakage as well as narrowing. So what causes this heart valve disease? Some people are born with heart valve disease. This is called as congenital heart valve disease. It can happen along with other congenital heart defects such as a hole in the heart or an extra vessel. They include either an atretic or a dysplastic valve, which simply means either the valve is absent or abnormally formed. And then there is bicuspid aortic valve, a variant of aortic valve wherein normal three-cuspid aortic valve is replaced by two-cuspid valve. This condition affects 2% of general population. These individuals may not have any symptoms till they reach 40 to 50 years of age, after which they may develop valvular stenosis or regurgitation. Heart valve disease can also develop over time as you get older with age, which we know it as a sclerodegenerative valvular degeneration. The heart valve here becomes thick and stiff, causing by wear and tear of the valve, which may lead to valvular stenosis or regurgitation. One of the frequent causes of valvular disease affecting rural Indians is rheumatic fever. An untreated streptococcal throat infection can lead to rheumatic heart disease, which can harm the heart valves. The damage may not show up for years. As a prophylaxis, it is indicated to take antibiotics to cure streptococcal throat infection before it can cause a damage in your heart valves. Then comes endocarditis. This is a rare infection in the lining of the heart and the heart valves. It is usually caused by bacteria in the bloodstream, rarely by fungus in individuals who have low immunity. Many people live their whole lives with a heart valve that doesn't work perfectly and have never had any problems. But heart valve disease may get worsened slowly over time. You may develop signs and symptoms such as shortness of breath. You feel like you're not getting enough air. There can be fatigue, swelling in your feet, ankles, or a distended abdomen. Or even the neck veins can look engorged or dilated. Some people may have chest pain when you are physically active. And then comes arrhythmia, a problem with your rate or rhythm of your heartbeat. Some individuals encounter dizziness or fainting. If you don't get treated for your heart valve disease, the symptoms and the strain on your heart may keep getting worse and may eventually lead to heart failure. Diagnosis of valvular heart disease involves a combination of clinical evaluation and diagnostic tests. A thorough medical history and physical examination are essential. Your cardiologist may listen for a characteristic heart murmur using his or her stethoscope, which can indicate the presence or type of valvular dysfunction. This sounds may mean a valve isn't functioning normally. It can either be a valvular leakage or a valvular narrowing. Few signs that a cardiologist may look for in heart valve disease is a weak pulse, fluid in the lungs, or a swollen leg, and blood pressure fluctuations. Individuals who are suffering from rheumatic fever or rheumatic heart disease may have joint pain or rashes. Eventually, you will need imaging in the form of echocardiogram, where an ultrasound wave studies the heart meticulously. It is capable of detecting almost any valvular heart disease. Some individuals may need an endoscopic echocardiogram, also known as a transesophageal echocardiogram, to obtain more information for diagnosis and therapy. If needed, your cardiologist may subject you for cardiac catheterization to study the physiology of diseased heart and decide appropriately on the mode of treatment. Treatment of valvular heart disease varies based on the type and the severity of the disease, as well as the symptoms presented by the patients. Some infants and children who are born with a valve problem may need surgery during childhood. When it comes to medically managing a valvular heart disease, if you are suffering from a mild to moderate valvular heart disease and if you are free of any symptoms, you may not need any treatment. Although a close follow-up is mandatory to keep a watch on the worsening of the disease. Although medications cannot cure your heart valve disease, they and a healthier lifestyle can help with symptoms and decrease your chance of having a stroke or a sudden cardiac arrest. You may be able to stop taking some medications after valve surgery, but you may need to take other medicines for the rest of your life. Your doctor may prescribe medications to help you with preventing arrhythmia or blood clots, bringing down your blood pressure and cholesterol levels, and treating heart failure or coronary artery disease. Coming to the next form of therapy which we can offer for valvular heart disease is minimally invasive procedures. Not all the diseased valves of heart require an open heart surgery. Advancements in technology have led to the development of lesser invasive techniques such as TAVR, where we replace the aortic valve with a single puncture through the skin. So TAVR expands to transcatheter aortic valve replacement, which is particularly beneficial in high-risk patients. It is fascinating to know that a large diseased heart valve can be replaced with an artificial valve which is made up of porcine or bovine heart pericardium with a small skin axis. It's time to update our knowledge on treatment options available for valvular heart disease. Some candidates may not be amenable to medical treatment or lesser invasive surgeries like TAVI or TAVR. Such individuals are a candidate for surgical interventions, where a cardiothoracic surgeon will offer you treatment options according to the disease severity. He can offer you either a valve repair or a valve replacement. Valve repair is when a surgical repair of the existent valve is preferred, particularly in the mitral valve, as it often leads to a better outcome. If the valve is not repairable, then the valve has to be replaced. When we talk about replacement of valves, the options that we have got is either a metallic valve or a biological valve. Individuals who undergo a replacement will need a lifelong anticoagulation, and some who may have opted for a biological valve may need a very temporary form of anticoagulation. There may be a few complications of valve surgeries that you should know of. The topmost is a risk of infection, then comes bleeding, then there is a risk of stroke because of an increased incidence of atrial fibrillation. Some individuals may suffer kidney failure. Long-term management of valvular heart disease involves a strict follow-up. and monitoring to assess the progression of disease and the function of any surgical repair or replacements. Patients may require periodic echocardiogram and clinical evaluation to adjust treatment plans accordingly. Patients are encouraged to adopt a heart-healthy lifestyles, including regular exercise, a balanced diet, and smoking cessation to improve overall cardiovascular health. People with heart valve disease should talk to their healthcare provider about the increased risk of getting infective endocarditis. This infection can greatly damage or destroy your heart valves and can be fatal. You are at a risk even if you had surgery to repair or replace your valve. Educating patients about their condition, potential complications, and the importance of adherence to treatment plan is essential for the effective management of valvular heart disease. To prevent infective endocarditis, tell your medical or dental providers that you have valve disease. Call your surgeon or a cardiologist if you have symptoms of an infection. Take good care of your teeth and gums. Ask your doctor if you should take antibiotics before any dental surgery or a major or a minor surgery or any form of invasive test, be it an endoscopy or a colonoscopy. Although heart valve disease is a lifelong condition, you can manage it with medications or with surgery. Your healthcare provider can talk with you about the best option for your situation. Regardless of what your provider does, you can do your part too. You can get more exercise, eat healthy heart food, avoid using tobacco products. Be sure to keep taking any prescribed medicines and go to all of your follow-up appointments. I believe I have touched all the important aspects of valvular heart disease. So that's all for this video. If you have liked the video, hit the like button, comment down for any queries, and subscribe to Star Health Insurance YouTube channel for more informative tips. See you next time.